Good morning, Mrs. Lee. I was told that your child has persistent high fever for 6 days, and also the red eyes and cracked lips. Is that true?
是的，医生。他大概6天前开始发烧，到现在一点都没退。眼睛一直很红，嘴唇又干又裂，还会流一点血。我真的很担心，他这几天也特别容易烦躁，没有精神。
Based on what you've described, I'm concerned that your child may have a condition called Kawasaki disease.
这是什么病？危险吗？
Kawasaki disease is an inflammatory condition that mainly affects young children. It causes inflammation of the blood vessels throughout the body. The good news is, if we treat it early, most children recover completely without long-term problems.
要做哪些检查才能确定是不是真的川崎病？
To confirm the diagnosis, we'll start with some blood tests to check for signs of inflammation, such as high white blood cell count. We'll also look at his liver function, platelets, and electrolytes. In addition, we'll do a urine test to see if there's any sterile inflammation. Finally, we'll perform an echocardiogram and possibly an ECG to check if the blood vessels are affected in any way.
治疗是什么？我们什么时候可以开始呢？
For Kawasaki disease, we usually treat it with a medicine called ENG, which stands for intravenous immunoglobulin. It's given through an IV drip and helps reduce inflammation and lower the risk of complications. We'll start it as soon as possible, ideally within the first 10 days of fever. In addition, we'll give a small dose of aspirin to help with inflammation and improve blood flow.
这些药有没有副作用？会不会影响孩子以后的生长发育？
Most children tolerate IV, IG, very well. Some may experience mild side effects, like a headache, fever, or a bit of nausea during the infusion, but we monitor closely and can slow down the drip if needed. Serious reactions are very rare. As for aspirin, the dose we use is very small, so it usually doesn't cause problems. And don't worry, the treatment won't affect your child's growth or brain development. Once the inflammation is under control, most children recover completely and go back to normal life.
那这个病会不会影响孩子以后的生长发育？
If we treat it early, which we are, it usually won't affect your child's growth or development at all. Most children recover completely and continue to grow just like other kids.
他需要在医院留宿吗？他大概要多久才能康复？
Yes, he'll need to stay in the hospital at least overnight so we can give him the IVIG treatment and make sure he responds well to it. Most children start to feel better within a day or two after the medicine, and their fever usually goes away. We'll also keep checking his temperature and monitor him for any side effects. Once everything looks stable, he can go home to rest.
你能帮我开一张学校请假条吗？
Of course, I can do that for you.
真的非常感谢医生。我还想再问一个问题，这个病会不会传染？我担心我女儿也会被传染到。
Kawasaki disease is not contagious. It doesn't spread from one person to another like a cold or chickenpox. We still don't fully understand what triggers it, but we know it's related to how a child's immune system reacts, not to germs that can be passed around.
非常感谢医生，请问我们什么时候要回来复诊？
You're very welcome. For follow-up, you can see his regular pediatrician in about a week. They'll check how he's recovering and make sure everything looks good. If there's anything unusual before that, don't hesitate to call us.
这个病有疫苗可以预防吗？我真的不希望他再经历这种事情。
I'm so sorry, but there's an emergency I need to attend to right now. I'll be back as soon as I can to continue our conversation.